Covering the islands of the Bahamas, ZNS Network presents The Bahamas Tonight.
Good evening and welcome to The Bahamas Tonight. I'm Giovanni Stewart. Thanks as always for joining us. A man with a long criminal rap sheet dies while in police custody, and his family is now demanding justice. The victim's mother was at first happy that police took him into custody to shield him from alleged hitmen, but now she's claiming that the police must answer for his sudden death. Our Vaughn Aubrey has tonight's top story.
A three-line statement from police Saturday angered the family of Tyrone Saunders, the 22-year-old father who had a long rap sheet and was reportedly expected to answer death threat charges in court on Friday, but was unable to as he was taken into police custody on Thursday night at the Grove Police Station. On Friday night, he was found unresponsive in a cell at the CDU headquarters on Thompson Boulevard. His mother, Joanne McKenzie, claims she last saw her son at 8 o'clock Friday night, and a police vehicle came to escort her to CDU at 9:40 p.m. to tell her that her son had died.
So they went to interview him and they realized that he was unconscious. So I asked him, I said, how he could have been unconscious and I just was here 8 o'clock. You understand me? 8 o'clock, I said, man, you mean to tell me y'all, bring me here to tell me y'all and kill my child in the station?
Police say Coroner Linda Virgil was later called into CDU. This was followed by Saunders' body being taken to the Princess Margaret Hospital, and a meeting ensued with police and Saunders' mother. She claims she got no answers on how her son died, and as of Saturday, no official had reached out to her.
And they didn't even have the decency to drive me to the hospital and say, well, just let me look on my child body. Huh? I need some justice.
McKenzie has not seen her son's body since his death. She admits that he was no saint, having a number of court cases. Family members also acknowledge that he was shot twice, last year and in 2010. Lately, his mother alleged that masked gunmen were seen near their home.
I was praying and hoping that the police would arrest TJ for the safety of him from these gunmen which was around lurking and to try to take my child life. I pray to God that the police did arrest him just to keep him a little longer. And not knowing that when they arrest him, that way he was going to die in the policeman on.
Now she is seeking justice, saying she is not afraid.
I was afraid when the gunman them was in the back there, they ski mask on. That's when I was afraid. I ain't afraid now. And I walked through the valley of the shadow of death. And I fear no evil. And the CDU is a joke.
Seeking comment, ZNS News spoke with the police liaison officer who referred us to Coroner Linda Virgil. Our messages were not returned. I am Vaughn Aubrey, ZNS News.
Meantime, one man is left in critical condition and another is listed as serious after they were both shot early this morning. Police say the two injured men were part of a group standing on the corner of Palm Beach Street and Robinson Road around 2 a.m. Saturday when they were approached by three men who fired gunshots into the group. A 29-year-old Seabreeze resident received a gunshot injury to the head and was taken to hospital via EMS personnel, where he is detained in critical condition, while a 17-year-old resident of Ridgeland Park was shot in his knee. He was taken to hospital via a private vehicle, where he is detained in stable condition. Police are questioning three men and a woman in connection with this incident. From the health sector, the much-needed new multi-million-dollar critical care block under construction at the Princess Margaret Hospital is said to be progressing well. It's a state-of-the-art facility designed to enhance services at the nation's primary health care provider. Carla Palmer reports.
Construction of the new critical care block at the Princess Margaret Hospital began last year. And when weather conditions permit, workmen are reportedly working in earnest to a June 2013 deadline. Even prior to assuming office as the new Minister of Health, Dr. Perry Gomez was familiar with the project.
You look at the critical care block as one example. I think it's something we have talked in this room about for a long time. And I was happy to see it come to fruition.
With the third level of the facility now going up, the benefits accompanying the new critical care block are expected to be extensive and rewarding, beginning with more space.
More people in ICU at any one given time. We should have less of a problem with having people to wait to get an ICU bed. There's a step-down unit which will also facilitate more intensive care at that level.
And there's more, says Director of the Public Hospitals Authority, Dr. Herbert Brown.
We will have 6 brand new operating theaters, state-of-the-art. We will also have a 20-bedded single-room ICU, as opposed to what we have now is the open concept. We will also have a 48-bed neonatal intensive care unit. We will also have a brand new state-of-the-art lab and other support services like medical and surgical supplies, enhancing our facilities in that regard. And for the first time, we're going to have a food court. And so where members of the public who might be visiting their loved ones in hospital will be able to go and relax and have a meal.
An expanded facility will mean an increase in staff from its current complement of 1,800.
The cost last year to engage, well, when I say last year, I'm really talking about this fiscal year, 11-12, is going to be in excess of $700,000 to be able to engage the nurses that we would have engaged. When we put into consideration salaries and the other benefits, it's a tremendous amount of money.
Brown added that not only is the new facility on schedule, but on budget.
To this point, we would have spent about $23.5 million. The construction project is going to cost, inclusive of the duty, $64 million. And we expect that we will be spending in excess of $30 million to ensure that we have, as the minister rightly indicated, a first-class facility.
Carla Palmer, ZNS News.
While the government is also advancing plans to improve community-based health care throughout the country, even as the multi-million-dollar upgrade of PMH is underway. Following a tour of the hospital yesterday, Health Minister Dr. Perry Gomez visited the South Beach Community Health Center, where he spoke about further plans to improve the health care system.
It's a full-service clinic. You know, it has laboratory, radiology, and good caliber of staff here. There's dentistry as well. And so it's a model-type clinic, and we are proud of it. And it has a good reputation for service.
The health minister says using the South Beach Center as a model, the government hopes to likewise upgrade facilities at community clinics throughout the Bahamas. But as it works towards that expansion, the government is reviewing and looks to improve upon existing deficiencies at all polyclinics, including South Beach.
With use, there's always need for upgrades, and they have issues with some parts in the radiology department with using an old machine trying to go from analog to digital. So that should hopefully be fixed for them soon. In dentistry, there are some issues in the equipment as well, so that needs to be addressed.
Dr. Gomez says in the near future, the government would like to introduce longer operating hours at clinics and add specialized services like family practitioners and dental hygienists. Meantime, the health minister is once again encouraging members of the public to, where possible, utilize their community clinics first before heading to the accident and emergency unit at the hospital in an effort to improve wait times and service at PMH.
And so that you get non-emergency and even emergencies in a particular area. Why do you have to go all the way to Princess Margaret? And there's this nice clinic here in South Beach or in Fleming Street or in Elizabeth Estates, you see? And so to make more use of the clinics in the neighborhoods where people live.
While successive governments have appointed trained and noted doctors as health ministers, and this administration is no different. Expressing her confidence in the new Minister of Health, nurse in charge of the South Beach Health Center, Bernadette Saunders, underscores the importance of having someone with experience in the sector at the helm.
He has hit the ground running, and that's what we did. A lot of challenges that we were facing when Dr. Gomez did his tour of the clinic, instead of us identifying them to him, he identified them. And he asked us some pertinent questions, so we know that he is well on the same page with us in getting these challenges corrected and for us to move ahead in healthcare.
Still ahead in the weekend report, local manufacturers feeling the pinch from the slowdown in the economy. Their story coming up.